asked to talk about what are the particular challenges rolling out a programme in a health and care sector. So I'll tell you a little bit about our programme as I'm talking about the challenges. So one of the challenges is about the size, range and number of organisations that are collaborating. If we look here, we've got our 9 innovators, we've got the 2 vanguards of that are delivering, we've got our evaluation undertaken by Lancaster University, and if I don't say that they are in the top 10 in the country, I'll be really severely told off. The governance is done through Lancashire Foundation Trust, who are the host for the testbed, and we also have the Lancaster Health Hub and the Innovation Agency involved with us. So where you can see there, as I say, the number of organisations that are collaborating is huge. So the challenges are, you're talking to 70 individuals from the organisations, communication pathways are so different, operating systems for IT are different, you're competing for different priorities, governance including IG. However, we managed to do that quite neatly through using an information gateway process, which we have locally, and that really helped with our IG solution. Healthcare, the lead innovator is a multinational company. We've got SMEs, we've got third sector, so all the different cultures within those as well we're managing. We're finding and agreeing common goals with individual values and priorities. However, what you can't argue with is, if I think about our statement from Lancashire Care, high quality care at the right place at the right time every time, nobody can argue with that. So equally, if you're from another one of the organisations, theirs is quality, safety, accountability, you can't argue with that either. So if you build on those common values, you're working towards you're all going in the right direction. And the other thing that is really important is the protection of reputation for all the partners. All the partners are investing heavily in this, but actually, each has a reputation to maintain, and especially if you're a company or you're trying to launch your product, that is really important to you, as is the reputation of the healthcare provider. We have 2 different care models, as you can see here, with our vanguards. So we have Foul Coast Vanguard, which is looking at the neighbourhood teams and referrals into neighbourhood teams. And then we've got the Better Care Together model, which is the integrated care communities. So we're working there with the GP super practices. So our main practice has about a patient roll of about 65,000. So we're recruiting patients from both different vanguards, which is very, very fascinating to see the different way that those recruitments are coming through. So those are the challenges there, the different models of care, different care pathways. Varied interpretation of risk has been really interesting. GPs picking out from their own caseload and managing their own caseload. Their view of risk is very different to the care teams, the enhanced primary care team, who are looking after the patients on behalf of the GP. They have a very different view of risk and where that risk sits, so that's been really interesting. Recruitment of clinical staff is across the country really, so the availability of and the lack of and the time taken to recruit staff. And also we've got the provider commissioner arrangements. Am I commissioned to do that? I'm not sure if I am, and how we have those conversations. Procurement and commissioning, right from the very beginning, we've got to look at now the spread and adoption of testbed technology solutions, so how are we going to roll that out? Partners competing for the same contracts. If you think about the number of people who are in this testbed programme working together, as contracts come out from wherever it may be for community, you could find that Lancashire Care is actually bidding for the same contract as Blackpool Teaching Hospital might be. So it's how do you maintain really positive working relationships while those are going on, and also how we work within the procurement guidelines. A huge number of initiatives going on, especially in our area. So we're competing for resources, competing for patients and clients, managing evaluation protocols. We've got a huge evaluation protocol going on for both vanguards. There's our huge evaluation going on. We've got a Healthy Newtown. We've got the STPs, the LDPs, all that going on. So how are we managing all that as well? How to overcome the challenges. It's really, it's a bit like reinforcement with children, is this, through the day as we're building through from this morning with Jocelyn and through everything. It's like, have a longer lead-in time. And use it carefully. Ensure that a pro forma agreement's in place prior to your start, which we had, which was an MOU. And then we went on to the collaboration agreement. Our collaboration agreement is like war and peace. It doesn't need to be. It doesn't need to be. Because the longer you make it, the more there is to argue about it. So if you keep it nice, clear and succinct, the better it is. Build the programme with an ethos of mutual respect. There are different people bringing different expertise to the table, and so what we make sure that we do is respect their expertise. I'm not a tech expertise, I'm a programme manager expert. So, and I don't pretend to understand half of the clinical things that go on, but I have clinicians around us who advise that, and so we have that mutual respect. Find common ground with partners and build on it. Remember, there's always a solution, we just have to find it. And find the right individuals, find the right people to talk to who can make a decision, just to find that person. Listen and communicate with all involved and never give up. Thanks to Lancaster University, as I say, who've helped us with some of the lessons learned evaluation that they've done. And those are our details for anybody who wants to contact us. We are quite vocal on Twitter, so if you want to follow us on Twitter, you'll see a lot of activity going along there, and we'd love to hear from you as well.
Thanks very much.